everyone. My name is Brice. I'm a coach with VGP, and for this week's Management Insight, I thought I would do a quick recap from the webinar I did last week, How to Create Standards of Care and Proven Process for Your Hospital. Standards of care and proven process are so very important to our daily lives in veterinary practice. Creating standards of care help ensure that patients receive consistent care during high-touch moments throughout the practice. They set treatment expectations for your clients and help your team deliver consistent patient care. They provide formal guidelines to support effective management and improve operational efficiency for your practice. I noted numerous times throughout my webinar that consistency is key. And keeping to that, I've created an exercise to assist in that consistency for creating standards of care for your practice. It will be available in the comment section of this post. When you begin creating your wellness and illness standards of care, consider the 80-20 rule. What are your top 20% most commonly seen requests, issues, and illnesses? Consider different life stages, such as puppy, kitten standards, adult dog, adult cat, senior dog and cat, and of course, top illness cases, maybe ear infections, vomiting, diarrhea. Remember to focus on always improving the client and patient's experience. So how do you do this? Let's break it down. Host a meeting with the doctors. Doctors should ideally be meeting once a week to discuss cases, standards of care, protocols, new journals and research, etc. This time should also be used to ensure new standards of care and protocols stand up to industry standards and still serve their purpose to enhance your client and patient's experience. These meetings can be done off-site, maybe over dinner, or even first thing in the morning over coffee, or if you're like me, with tea. Divide up the top 20% wellness and illness topics. It may be a good idea to have a few topics in your hip pocket to get the conversation started. You could even run a report from your practice management software that outlines the top 10 visits in your practice. Or do you use Vet Success? It can most certainly do exactly that for you as well. You could even narrow down patient demographics by using your Vet Success report. Would we be able to increase our ACT by better understanding what should be discussed during the appointment with puppies, kittens, adult dogs, or cats? What is your hospital seeing the most of? Next, assign each doctor 2 to 4 diagnoses for which you want to bring industry standards into your practice. Then set a due date for when research needs to be completed. That should be at your next doctor meeting. Each doctor there will share their findings, discuss, and come to a consensus regarding standard of care. Remember, in pathway planning, we talk about narrowing things down and creating laser focus. It's okay to start with just a few standards and then brainstorm from there on each topic. You don't have to create everything all at once. Keep it simple and set yourselves up for success. Next, a protocol or standard operating procedure for the practice will be created based on the standards you put in place. Once you have your standard of care and supporting SOP, you can break it down into the proven process by which the team can be trained and follow day to day. This is where you can actually include your team as well. Choose from the standards that have been created or revised by the doctors. Or if you already have standards of care in place, poll the team to identify areas of need to improve efficiency. Start with items that affect client and patient experience and create a priority list of proven processes to implement. Proven processes are the abridged versions of your standard operating procedures or SOPs. They consist of only the most critical 3 to 5 steps of a process and serve as a tool to set expectations for your team about how services are to be delivered every single time. Having only 3 to 5 steps is beneficial. It's easier to know where a misstep happened in a 3 to 5 step process than a 45-step SOP. By creating and implementing proven process, you increase the productivity, efficiency, and responsiveness of your team, along with streamlining your delivery of service. It's important to note proven processes are not only limited to medical care, but can be implemented in all aspects of your practice. I hope this was a helpful, abridged version of my webinar for you guys. It is so important to have standards of care in place and processes to support it. Remember, this is an excellent way to support your team and bring dollars back to your bottom line by creating consistency and an efficient team with a clear understanding of your expectations. I hope you all have a wonderful rest of your week and get your doctor meeting scheduled straight away. Until next time, bye-bye.